Hello and welcome back to Coastal Pearl Podcast. I'm your host, Megan Nager, and today we are so excited to be joined by Dr. Daniela Dadurian of MD Beauty Labs, located in West Palm Beach. And we are going to be discussing what sets a doctor-led aesthetic practice apart from other traditional med spas, why medical oversight matters, and what aesthetics are trending into 2026 and beyond. So we are so excited to be here. Let's get into it. So, hi, doctor. Do you
Hello.
say Dr. D?
Yes.
Okay, Dr. Body's here. Yeah. Okay. Well, it's so nice to meet you.
Thank you for having me.
Of course, it's an amazing practice. So, could you tell us when you started this and what basically got you into this?
MD Beauty Labs was created in 2001 as a marriage between my knowledge in internal medicine and my passion for aesthetics. In 2001, I had a very busy internal medicine practice, and it was also the year that Botox was FDA approved for cosmetic purposes.
Okay.
And that sparked my interest in minimally invasive procedures. And I had a vision that there was a need for patients to address their health and wellness concerns, as well as their aesthetic concerns, in a safe medical practice with their trusted doctor. So I wanted to combine health and wellness and beauty from inside in, which was really a very novel approach at that time. Because you really had everything separate at that time. You had cosmetic dermatologists, you had plastic surgeons, and you had internists. But you didn't really have anybody that would look at the whole picture.
I love that. And that's very big now, like holistic,
Yes.
the whole body. Basically, you're treating it all at once.
Yes.
Yes, I love that. And it's funny to think about how Botox is fairly new. I think people think for like centuries, people have had Botox, but it's very new for
Yes.
the most part. What would you say, you kind of touched on it, but what would you say is the biggest thing that sets MD Beauty Labs apart from other traditional med spas?
I believe it's our passion here, mine and my providers, to find the safest, most advanced techniques, technologies, products that are available to us, and to provide very effective treatments.
Why would you say being a doctor-led aesthetic practice is so important for safety as opposed to just a med spa run by like an RN, for instance?
I believe it's the experience, the knowledge, and the training that's very important. A lot of med spas do not have a physician leader who will make sure that safety is enforced and they're properly trained.
Yeah, I've been to those before, and then you get a lot of stuff dissolved. Yeah. You have close to 30 years of experience, which is crazy. How would you say your approach or like the way you're treating people has changed over the years?
Patients try to shy away from surgical procedures as much as possible. They are more interested in non-surgical procedures, or at least they're interested in postponing surgical procedures as much as possible.
So would you say like more natural looking than it used to be?
More natural looking, and also cutting down on surgery and doing other technologies, whether it's lasers or biostimulatory agents to stimulate their own body to produce collagen or skin tightening versus going under the knife immediately.
Yeah, that sounds better. It's like a big thing to jump into. So, why would you say that using primarily FDA approved, products and procedures, why does that matter as opposed to non-FDA approved?
It's safety. Again, these products in this country, we go under rigorous testing and safety studies. So we're pretty sure that that's the best we have available and the safest for our patients.
Yeah, of course. You're not injecting something random into your body. How would you say continuing education strengthens your team standards? So you guys are constantly learning and growing.
We're constantly learning. We're constantly updating ourselves to new technique, new safety measures, new technologies.
Yeah. And they come up a lot, it seems like. There's like always something new in this world.
Absolutely.
Yeah. Yeah.
It's really exciting, actually.
It's like hard to keep track of all the new things that are coming up.
Yes.
Yeah.
It really is.
So you did kind of touch on this, but with the rise of, I've noticed there's so many different med spas popping up. They're all over. What would you say is the biggest risk for customers who are going to them? Basically, if you're someone new to this and you have no idea.
That the providers are not properly trained, that
Mhm.
they're using unsafe materials, products, and also that there's no medical supervision, so that there's nobody on site that can address complications immediately
Mm.
and in a timely manner.
Because even if you have like a doctor on Zoom, for instance, it's different than somebody who's literally in there in person.
Exactly.
Yeah. What are some misconceptions that patients have when they come in for the first time about just aesthetics in general?
I feel some patients feel that it's a very easy procedures to
Mhm.
inject Botox. Anybody can do it. It's very easy to operate a laser, and they don't really realize the potential adverse reactions that
Mhm.
that can happen,
Yeah.
and how important it is to have properly trained providers.
Yeah. I think because it's so trendy, people are like, oh, it's easy to do, but it's not.
Yes.
You're injecting something into your body. So, what are some red flags for somebody who's trying to go into an aesthetics practice right away? Obviously, they're going to come to you, but in case they don't, what are some red flags that they should watch out for?
That it's not physician run,
Okay.
and also if something is too cheap,
Yes.
most likely there's something wrong with
Yes.
it.
Yes. Like, because I mean, I'm sure places even will just fill it with saline or stuff like that.
Yes, even with Botox, it depends what kind of concentration you use, whether it's watered down, whether it comes from a proper source, whether it's
Yeah.
real Botox. Those are all concerns that people really don't think about.
Okay. So we're in 2026. Trends are always changing, obviously, especially in aesthetics. What would you say the trends you've seen are now and that you think will be moving into the future?
The biggest trend I see is using biostimulatory products, meaning stimulating, using substances that stimulate your own body to produce collagen.
Okay.
That seems to be the biggest trend right now. I just went to an aesthetic conference in Miami 2 weeks ago,
Wow.
and it was all teaching about basically using natural substances, more like the holistic approach to aesthetics.
Okay. So instead of, for instance, like filler, like hyaluronic acid, you're using
Exactly.
your own bodies.
Or substances that stimulate your own body
Okay.
to stimulate collagen production, like PDRN, like Sculptra,
Okay.
that type of
Sculpture I've heard
things.
of.
Yes,
Okay. So, and that's something that you're not going to immediately see, right? It builds over time.
exactly.
Okay. Works. Okay. So, speaking of trends, I think sometimes men think that this isn't for them, but it is, right? Like,
It absolutely is.
do?
And actually, I feel that just as many men want things done, whether it's aesthetics or wellness in
Mhm.
terms of hormone replacement or lasers or even Botox and fillers, but they're just not as willing to admit that they're doing it. It's kind of like women used to be 20 years ago.
Yeah.
Um, but in my practice, 40% of patients are men
Wow. Okay.
and growing rapidly.
Wow. So, and what would you say are the top procedures that men want?
Hormone replacement, IVs,
Okay.
lasers, and Botox and fillers.
So they get Botox and filler too. Yeah. So it's all the same as the women.
Totally.
Yeah. So men, don't be scared. Come on in. And would you say the same trends with them as well? The more natural
Yes.
products as well?
More so in men than women. Men
Really?
really want to do things, but they don't want anybody to know.
That's so scared. Exactly. You don't want anyone to see.
Speaking of trends, I feel that Melissa is really knowledgeable and she can share more since she's also much younger than me.
Okay, perfect. We'll go talk to Melissa. Thank you so much.
Thank you.
Sadly. Okay, so we are now here with Melissa. And hello, welcome. So, can you please explain your role here, what you do, and how long you've been in aesthetics?
Yes, so I'm a physician assistant. I'm the PA here. I am an injector. I also do hormone replacement therapy here, prescribe peptides.
Oh, you
and-
mentioned peptides.
Yeah, peptides as well. And then also lasers. I've been with Dr. Dadurian since 2019, which also started my aesthetic journey.
Okay, awesome. So, so you've been here a minute. Yeah.
Yeah.
Yeah, that's awesome. So, okay, we were just talking about with her. What would you say are the biggest trends you've seen heading into 2026 and you think that are going to keep going on.
I feel like wellness is such a big trend right now. And with that, we're seeing patients who want to look more natural. They want to just look refreshed and rested versus these huge transformative treatments, dramatic results.
Well, yeah, I feel like I was also living in Los Angeles, so I feel like that says something, but I like 2017, 18, when everyone would come out and you just look like a different person, that's like no longer.
Exactly. Yeah. And, I also feel like patients are more educated now. So they also want to be, they're on ChatGPT, they're on, Google, and they want to be more strategic and they want to, plan more long term.
Right, not just like fill my face up.
Right. Yeah. We're not just correcting, we're planning for the future, we're preventing, and we're slowing down the aging process. So patients are coming in younger as well, and they're saying, what can I do?
Oh, that's interesting. Like preventative.
Yeah, preventative.
So, okay, along those lines, what would you say are some procedures that you're doing that are delivering these more natural results?
Well, we're continuing to use neurotoxins like Botox.
Okay.
The way it's changing, though, is that patients don't want to be frozen anymore. They want to maintain their expression.
So you can still move your eyes.
They can still emote, yes. So with that, it's less dosing.
Okay.
With fillers, we are seeing patients becoming a bit scared of fillers. Now I sit down with them every day and I have to assuage their fears and say, look, it takes $10,000 worth of fillers to look like an alien.
Yeah.
Basically. So one syringe is a fifth of a teaspoon. If
That's so crazy to think about. That's like
very little,
microscopic.
Yeah. So it would take a significant amount of filler to make you look overcorrected and overdone.
Wow.
Which we're obviously swaying away.
Right. Which is funny because years ago, it's probably that you got scarred from seeing all the like crazy amounts of filler. Yeah. Yeah, that makes sense. Okay, so Dr. D touched on Sculptra. What are some others that you've been like using a lot? Or I guess Sculptra is one of them, obviously, right?
Yes. So we have, things like PRP, which is platelet-rich plasma.
Okay.
For those that don't know about it, it's basically we draw your own blood and we centrifuge it, we spin it for a certain amount of time, and it separates the platelet-rich plasma from the red blood cells. Then we re-inject the platelet-rich plasma into your skin. Now you can use it as an injectable or you can use it topically with microneedling, which is great for, improving your skin quality, which I feel is also a huge trend right now. We're very big on improving our skin quality and smoothing the texture. So another natural approach that, we're seeing is using Botox to improve our skin quality. So we're pairing it with microneedling to improve our skin quality, reduce our pore size, give you that glass skin look.
Wow.
We also have an injectable called Skin Vive. It's not a traditional filler. It's something that we do inject, but it's basically to hydrate your skin and boost your skin quality.
Okay. So again, it's using your body's own natural elements or whatever you want to call them, and you're putting that. It's like a more holistic approach, right?
Right. So we're not just replacing volume. We're addressing skin quality.
So there's some energy-based treatments that you guys use a lot.
Right.
Can you talk about those?
Yes. Patients are very concerned with the texture of their skin.
Okay.
So we're smoothing their texture. We're reducing their pore size. We're evening their skin tone. With that, we have lasers like the Halo and BBL.
Okay.
Now, the Halo is a hybrid fractional laser. It's a non-negotiable for me. I do it once a year. It's basically a reset button for your skin.
It sounds great.
Yeah.
And when you say, not to interrupt you, when you say, because I hear that a lot, fractional.
Fractional means it's not fully ablative.
Oh, okay.
CO2 is fully ablative.
Where it's doing everything. Kind of.
Right. So hybrid fractional means less downtime. It's not as dramatic.
Okay, so you can still go out. I know that's a concern for some people.
Yeah, and the Halo is great because it's customizable. So you can come in for a light refresh, or if you want to go more aggressive, we can do that too.
Okay. And living in South Florida specifically, I'm sure, I get them like brown spots all the time, sun damage.
Right. So the BBL is great for that kind of problem.
Okay.
The BBL uses broad spectrum light therapy to target like pigment, redness, broken capillaries. So I like to pair the Halo and BBL together because the two of them together are just amazing.
Okay. That sounds great. I like that. Okay, and then there's also some stuff like there's chemical peels. Are those popular?
I feel like they are regaining popularity because I feel like the trend is maintenance treatments.
Yeah.
Chemical peel is a great maintenance treatment. It resurfaces the skin, and you can do it on your own time frame.
Okay.
Yeah.
And then another one that you're everywhere that I know you guys do offer is this salmon sperm.
Yes.
Can you explain that a little bit?
It's so popular right now.
It's all over social media, and it's like all I see.
So salmon sperm. So basically with salmon sperm, people are using it topically and pairing it with microneedling.
Okay.
And it's basically DNA that they've extracted from salmon sperm.
Wow.
It's actually great because salmon sperm DNA is highly compatible with human DNA.
It's interesting because I always thought, I'm like, why salmon? That's
Yeah. So that's why.
interesting.
Yeah, and it helps improve like your skin quality. It's regenerative, and
Wow.
that's part of the trend that we're seeing.
Okay, so use that with microneedling. So you're like
Yeah. So
depositing it.
yeah, and it's giving you that glass skin glow. So it's great if you have events coming up.
Yeah.
To do that beforehand. Yeah, people are loving it.
And then do you ever have like salmon skin, just like a topical that people use?
You can
do.
use it just topically as skincare.
Okay.
And then you get more of a result with microneedling.
It's so interesting.
Yeah.
Morpheus that you offer, what does that do?
So Morpheus combines microneedling with radio frequency technology.
Okay.
So it's tightening your skin and improving the skin texture at the same time.
So for like under your neck, for
So
instance.
you can use it we actually have Morpheus for the face, but we also have Morpheus for the body.
Oh,
So I've actually done it on my abdomen post
I should do it.
baby. For your skin yes, I do know, unfortunately. I've seen really good results with it. But yeah, you can do for face to tighten that.
Wow.
Yeah.
We're also seeing, and Dr. D kind of touched on this, but more less invasive, non-surgical ways to just lift and tone.
Right.
So what are some procedures that you offer?
So we carry the Soft Wave, which uses ultrasound technology to heat skin and tightens the skin. It goes down to the mid-dermis. It's very popular. It's great for, it's actually full body. You can do it everywhere.
Oh, wow.
Yeah. And then we have the M-Sculpt Neo.
Okay, I heard of that.
Yeah, because that actually uses electromagnetic technology to like cause muscle contractions.
So it's like you're working out,
Yeah,
right?
like you can't achieve this stuff at the gym. Well, it's doing like 20,000 sit-ups.
Oh, wow.
Yeah, and how long minutes?
In 30 minutes.
Yeah, it's like that's why it's great because you can come in during your lunch break, do it for 30 minutes, and then go back to work.
Yeah, that sounds
There's
fantastic.
no downtime.
And you have to go to the gym.
Yeah.
Okay.
So it's great because it's building muscle and it's also tightening your skin because it's heating up the
Wow.
flow. Yeah.
And you offer that on your face?
Yeah, so the face, we have M-Face, which the same applicators are placed on the face. It's a 20-minute procedure. It tightens the skin with that, it heats up the skin, so it tightens it, but it's also toning the muscles under your skin. So it provides a nice lift.
Wow, I love that. Okay. So I'm going to ask you a personal question. Sure. What's your social security number? I'm kidding. What's your favorite procedure? Do you have one? You probably have multiple, but
like that I perform or that I receive?
Both. Both. I'm curious. Yeah.
Well,
if you had to pick.
Well, Botox.
Botox. Okay.
Okay. It's 100%. Now, outside of Botox, Halo and BBL.
Really? The lasers?
Yeah.
Okay.
Yes.
Because again, that's more natural.
Right.
Yeah.
I mean, with those two together, you're hitting on the fine lines and wrinkles, relaxing, the muscles, and then you're improving skin quality at the same time. Halo and BBL also, it stimulates, it's also regenerative. So it stimulates your own body to produce collagen as well.
Amazing. And if people are interested in lasers, you said you do the Halo once a year.
I do it at least once a year. You can do it, every 4 months, but I do it at least once a year.
Okay. So lasers are about half a year, every year.
Yeah. BBLs we recommend every 3 to 4 months for maintenance.
Okay.
Yeah.
So what's one more way, or any other way that people can, without being invasive, or if they don't have time to come get a laser or Botox, etc., that people can really help themselves and their skin?
Yes. So along with improving skin quality, skincare is huge right now.
Yeah.
Patients are consistently asking me, well, what should I use? Or I'm asking them, do you use skincare? And some of them say no. And I'm like, what?
Yeah.
I feel like after using skincare, after 28, I'm like, you got to do something. Yeah. You have to be using skincare. Yeah, skincare helps dramatically improve your skin quality.
Yeah.
And, we carry multiple products. Dr. Dadurian actually has her own line. It's
MD
Beauty Labs.
Okay.
One of a non-negotiable product for me is a retinol, because that, turns over your cells. And we have that here. And like a moisturizer, a nice moisturizer.
Okay. So if you're starting from ground zero and you're like, I have no skincare experience, what should I do? What would you tell someone?
I would say use a retinol,
Okay.
and use a moisturizer.
What about an SPF?
Moisturizer with FPF and SPF even better.
Okay.
I mean, this is the whole trend now, is finding these products that combine everything in them. It's hard to find, but you know, there are some that you can combine, you know, a couple things together, like SPF and makeup too.
Exactly. Or like a tinted moisturizer.
Tinted moisturizer. Or tinted,
Okay.
yeah.
So you guys are featured in the My Living Media publications along West Palm, Palm Beaches, Treasure Coast, and you are running some really great specials in them. So I feel like that would be a great opportunity to check out. So check those out. Come see Melissa, Dr. D. This place is very relaxing, welcoming. I'm really excited to go get my whole face done. And thank you for everything. It was really helpful. It was so nice to meet you.
See you soon.
Yes.